Parkinson's dementia: who, what, and how to diagnose, with Lucas Warner. During this PowerPoint presentation, we will identify the scope of the problem that Parkinson's disease poses to its sufferers. We will also discuss the pathophysiology of Parkinson's disease in the human body. We will discuss the clinical signs and presentation that typically is associated with Parkinson's disease, and discuss diagnostic approaches. The prevalence of dementia around the globe is far-reaching, with 45 million people globally affected by dementia. It threatens not only the physical safety of its sufferer, but also reduces their dignity. Many lose their independence and are forced to live with assistance. While there are many risk factors that can contribute specifically to Parkinson's dementia, it is important to note that it is not generally bound by either gender or race. According to Ashiero and Schwarzschild, there are 4 major risk factors for developing Parkinsonism. The first is exposure to insecticides. The second is having a particularly high dietary intake of dairy products, such as cheeses, milk, and yogurts. A third risk factor is having a history of melanoma cancer. And lastly, a history of traumatic brain injury. All predispose individuals for the development of Parkinsonism. Ashiero and Schwarzschild also identify 4 neuroprotective factors from developing Parkinsonism. They are smoking, caffeine intake, regular physical exercise, and a high serum urate concentration. Please note, before calling the Marlboro Man or whoever that lady is on the outside of the Starbucks cups, that the researchers only recommend physical exercise as a responsible protective factor from developing Parkinsonism. It is important to understand the pathophysiology of Parkinsonism to help guide treatment. The first step is that a progressive degenerative change occurs in the basal nuclei. This causes lowered levels of dopamine being secreted by the substantia nigra. This dopamine causes poor neuronal inhibition. Following this, neuronal agonists behave unchecked, causing muscular rigidity. There are certain telltale characteristic clinical presentations of Parkinsonism that aid with diagnosis. Some of these are a characteristic pill-rolling tremor in the hands, a mask-like face that reduces facial expression, a reduced affect, and a characteristic shuffling gait with short steps. It is interesting to note that the tremors present in Parkinsonism are often not present during sleep. According to Papadakis and McPhee, in their work Current Medical Diagnosis and Treatment, the 2019 edition, Parkinsonism diagnosis is typically very straightforward due to its characteristic clinical presentation. They list the pill-rolling tremor, previously stated, as being one characteristic that is kind of a telltale sign, the relatively immobile face, seborrhea of the scalp and the face, and also a loss of automatic arm swing during the shuffling gait that was previously mentioned. It is interesting to note that they mention the Myerson test for determining whether Parkinsonism could be the culprit. This test involves tapping repetitively on the bridge of the nose of a patient and assessing for a sustained blink response. While Papadakis and McPhee do not make any use of any imaging studies or laboratory values in their diagnostic routine, it is interesting to note that some researchers have found that by using single photon emission computed tomography on the brains of those with Parkinsonism, that areas of hypoperfusion are found distinctly in Parkinsonism sufferers in the occipital and cerebellar regions. This is useful to distinguish it from other forms of dementia. In conclusion, dementia is an ailment that takes much from its sufferers, including physical health and independence. Parkinsonism dementia is uniquely dangerous due to its effect on muscle control and response, in addition to its cognitive problems. Treating this prevalent disease should be a concern for all healthcare workers, and being familiar with the cellular changes, the clinical presentation, diagnostic tools, and treatment modalities available is very important to achieving patient outcomes. I hope you have learned something new about dementia and about Parkinsonism dementia in particular. Thank you very much for your time. This has been Lucas Warner.